I think it's important to understand the science behind this. The COVID-19 vaccine is not a live virus. There is no living particle in this vaccine. Old vaccines were that way. Previous forms of flu vaccines, smallpox, those things, we took a bacteria or a virus that was weakened, that couldn't cause a lot of disease, so it was like, we'd rather give you one small hit so that you can prevent a large hit later on. Completely different ball game. COVID-19 helps our bodies recognize viral components, not the virus itself. It's like taking the door handle off of your VW Bug and being able to identify, hey, this belongs to a VW, but you sure can't drive this thing anywhere, and it's not going to be worth anything. But if you recognize what we've done is taken a piece of that virus, shown it to your body in the form of the vaccine, where if your body does come in contact with that door handle, we know exactly what we're dealing with. And that bug's not going to be driven anywhere. We don't have anything in it that can create other copies of the virus. It's important to recognize the difference and understand that the mRNA technology of these vaccines, it's cutting edge. Some of the symptoms you get with the COVID-19 vaccine may make you feel like you've gotten a live vaccine, and that's body aches, feel fever, feel crummy, tired, flu-like symptoms. That means your body is responding to the door handle. It's recognizing this virus, it's responding to it, but you do not have the virus itself. You do not have an infection from that virus.
The technology actually is not new. mRNA technology, that's the Pfizer vaccine, the Moderna vaccine, they've been around for 30 years. And they've just been evolving over that time. We know that they're very effective, and we also know that they're very, very safe. They were rolled out quickly because the pharmaceutical companies were able to mobilize their resources to intensify their ability to bring this to the market quickly. So typically, a pharmaceutical company is not going to be able to do this very quickly because they have so many other projects in the pipeline. Well, because of the government support, because of the pandemic being as it was, the pharmaceutical companies were able to quickly get people to get this to the front and center of their resources, to front and center of their priorities for their companies, and thus get this to the FDA very safely. It's been studied for months. Tens of thousands of people. The vaccine has now been given to hundreds of millions of people, and it is a very safe vaccine.
There's not any data to suggest that it adversely affects fertility or trying to get pregnant, nor is there any data that suggests that it's dangerous or has an adverse effect on pregnancy. Over 160,000 pregnant women have received some of the mRNA vaccines at this point in time. What does have an adverse effect on pregnancy is getting COVID infection. ACOG and the Society of Maternal Fetal Medicine for higher risk pregnancies, they recommend getting vaccinated, and then if you get pregnant sometime between your first and second vaccination, they recommend for you to go ahead and continue to get that second. Because again, by protecting yourself from COVID, you are protecting yourself, you're protecting your baby.
When you're young and healthy, obviously you're bulletproof to a degree, right? But what I explain to teenagers, college kids, those in their 20s or 30s that feel like they don't need the vaccine, their demographic isn't getting very sick or hospitalized, is two things. One, if you do get sick, you're at risk to be hospitalized to some degree. And also, even if you don't get hospitalized, you could have some long-term effects, short-term memory loss, just chronic fatigue, coughing, oxygen needs, poor concentration. We're seeing these things as lingering effects of COVID infections, and that can happen at any age group. The second thing I tell the younger population is even if you get it and don't get very sick, you can still spread this to those at risk. And that's an important part of this, is getting vaccinated doesn't just protect you, it protects everyone around you, including those that are at great risk to be hospitalized and have severe complications.
We have to focus on the facts. This is not a living vaccine. The term shedding comes from if you are exposed to a virus, it gets in your respiratory tree, your nose starts running, you start sneezing, there are millions of copies in the air. That can happen with a live virus or a live vaccine. This is not a live vaccine. There is no living form of this virus in your body with the COVID-19 vaccine. So to say that you're shedding, it's an impossibility. It's like saying I'm pregnant. I can't be pregnant. You cannot shed. The facts of science preclude that. And I think if not to say, I say that somewhat tongue in cheek, but it's really important to understand the difference that to shed means to release live forms that are infective of other people. You cannot have that with a virus that's not alive. It's not a living virus.
In the first 6 months after having an infection, the studies show that you're very well protected, that natural immunity, meaning you get COVID and you develop antibodies, natural immunity is actually much better than anything else, including any vaccination. So I tell patients, if it's been less than 6 months since you had COVID and you're wondering, do I get the vaccine or not, there's no hurry on it, really, in my opinion, because you're not getting a benefit from the vaccine less than 6 months. Between 6 and 12 months, it becomes a little more gray. We don't know how protected someone is, how quickly their antibodies are going to fade in regards to their effectiveness in treating COVID if you were to be exposed. And so beyond 6 months, I'm recommending all patients get vaccinated because, again, that protection that they had from the infection is not going to last forever. Beyond a year, it appears that there's no protection whatsoever.
There's no evidence that it is harmful for pregnant women to receive it for themselves nor the baby. Having COVID infection while you're pregnant, especially recently, this latest variant has been especially hard on pregnant women, as well as the babies that are in utero. Many pregnant women have been hospitalized, many are going into preterm labor, many are delivering while on ventilators before they end up dying. If you are vaccinated in your 3rd trimester of pregnancy, you can even pass on some of your helpful antibodies to your baby, as well as through your breast milk if you're breastfeeding.
There's zero shred of evidence of anything of this nature. And I can understand people being concerned, and we can take it as a legitimate question, but there's no evidence whatsoever. There are so many people involved in the production of these vaccines and the science behind it that do this for a living. I don't do this for anything other than the fact that I want to take care of people. The healthcare professionals around us, the nurses around us, the scientists at the CDC, the people behind this. There's money being made, of course. It is a capitalist system, but it's important not to inject in ideas of conspiracy that will overshadow the ability of us to take care of our families and our communities. I think it's important to take a very serious look at it, get real, and look at the facts. And that's what I've done. I've looked at different sides of things, and when questions come up that have a conspiratorial feel to them, it's a legitimate question, but we also have to be satisfied with the answer when we think, there's really nothing to that.
I think that's just a lack of understanding of science and how mRNA and RNA in general is different than DNA. When we're talking about DNA, we're talking about what's in the cells, specifically in the nucleus of the cells. DNA is important in regards to the building of proteins and numerous things that we do, as is RNA, but they work completely differently. And so when you get an mRNA vaccine, it never goes to the nucleus of the cell, it goes to other parts of the cell, and so it doesn't affect the DNA whatsoever. There's no relationship between the two. When you get a vaccine, whether it's for COVID or flu or anything else, it doesn't create this force field around you where you can never get that particular infection. What vaccines are created to do, and the mRNA vaccines, again, Moderna, Pfizer, they're fantastic technology, they're safe. What they're created to do is help your body identify quickly any foreign infection, in this case, COVID-19 as a virus. And so when you do see it, if you get exposed and it gets into your body, whether from whatever source, once you do get that, your body can recognize it quickly. So what is happening in patients who are vaccinated is in the first, we think about 3 to 5 days, their viral levels, the virus levels of COVID-19 are going up at about the same rate as someone who's unvaccinated. But what happens at day 5 and no later, it appears, is that those who have been vaccinated, their virus loads start to go down very quickly. Those who are unvaccinated, their virus loads continue to go up very often. Hospitalized patients, ICU, medical beds, wherever, that are there for COVID-related complications, 90 to 95% of those patients are unvaccinated. And so, yes, you can still get COVID infections, infrequently very severe, but you can still get COVID infections if you've been vaccinated. It's just statistically very unlikely you're going to have any type of severe illness.
We're trying to knock out as much as we can with each round of these vaccines. I think the booster is a great idea. It's necessary. If we want to have a community where we can run around without these masks and run around without worrying about our grandparents or our children getting these infections, it's critically important that we take stock and balance and give ourselves the best shot at doing that.
It's essential that everyone be vaccinated. They're safe. They've been proven to be safe. They're effective. They're very effective. The studies are all there. And I encourage all people, if you're wondering whether or not to get vaccinated, please use reliable, scientifically sound sources when you're considering.
People who are in this business started it with the intent on helping other people. And if you lay all the facts out on the table, in my thinking it is, the best way for us to care for our patients is to protect them from the thing that could harm them, and that is COVID-19.
It is very surprising to me that there are a lot of healthcare workers that are not vaccinated, and they still have their concerns about safety. You know, we've tried to address these myths that are out there and try to take away kind of the political side of things and really stick to the science. And what the science says is the vaccines are safe, they are effective. But I know that there are still people that are on the fence, and I encourage you, talk to your primary care provider, talk to us. I want you to be safe, I want your families to be safe, I want our patients to be safe.